Hi, welcome to my YouTube channel. This is your friend Ashish from Ashish Coding YouTube channel, and today I'm going to reveal new career opportunities in the medical coding area. So let's start our today's video. In this video, I will explain you what exactly the medical coding, what are the different modules of medical coding, and what certifications comes under this medical coding domain. So let's jump into the mind map and understand what exactly the medical coding. All right. So medical coding is nothing but transformation of healthcare diagnosis procedure, medical services and equipment into the alphanumeric codes. So all the procedure codes are converted to CPT code. All the diagnosis code are converted to the ICD code, and all the durable medical equipment supply injection codes, all these codes are converted to the HICPIC codes. So there are total three modules in the medical coding: CPT code, ICD code and HICPIC code. In the CPT code module, it include all the medical, surgical, diagnosis services. For example, all the surgery procedures performed by the surgeon, all the radiology procedure performed by the radiologist, all the pathology test performed by the pathologist. It means all medical practitioner who provide any kind of services to the patient, all these procedures are converted to an to a numeric code set into the CPT module, and each CPT code having a specific dollar value linked to that code based on the guidelines of the CMS Medicare and Medicaid services. All right. Next module in this is here is the ICD-10 CM module. In this module, it is a International Classification of Diseases 10th revision clinical modification system. It include all the diagnosis code, all the symptoms, all disease disorder symptoms to the patient. All these disease disorder symptoms are converted to an alphanumeric format code in the ICD-10 CM. So this module include all the diagnosis code. Third module is the HICPIC codes module. HICPIC stands for the Healthcare Common Procedure Coding System code set, is used to build DME supplies, drugs and injection codes. So these codes are usually used to build durable medical equipment, supplies like diabetes machine, that glucose monitor machine, the pap smear machine, means all the equipment that is used at home by the patient, all the injection drugs that is injected by the particular doctor to a patient, all these converted to the HICPIC code set. So this module include all this information in the code format. So these are the three modules which comes under the medical coding. Now we understand what are the certifications under this medical coding. So the certification under this medical coding is CPC certification. CPC stand for Certified Professional Coder. This certification is accredited by aapc USA, American Academy of Professional Coding System, United States of America. These are the agency who conducted the certification exam across the globe. So, and this certification is valid across the globe. So once you get this certification, there will be huge career opportunity in this medical coding field. So let's understand what exactly this CPC certification and what are the different modules come under this CPC certification. So let's jump into the second mind map, which is CPC certification. All right. So CPC certification, it includes, first we understand what exactly the exam format of this CPC certification. So usually there is a 150 question mark exam. It include 150 questions, and there are the passing percentage for this exam is 70 percentile. 105 marks is needed to pass this certification exam. The total time duration for this exam is 5 hours 40 minute exam, and it's a open book paper based exam. So student needs to use, or any CPC aspirant needs to use, three books. First book is CPT, second book is ICD-10 CM, third book is a HICPIC books. So these 3 books are provided by the exam center to the student, and student can use this book and give their CPC certification exam. So it's a open book test, but it's a time limit is 5 hours 40 minutes and 150 question marks exam. So usually 2 minute 30 second is the time allotted for the per question in this exam. All right, so there are, let's understand the what are the different how it's the curriculum design for this CP certification exam. So 150 questions is divided into a 12 distinct sections. It include the first section is surgical procedures. This is very important section, and the code series for this surgical procedure is start from 10004 to 6990. These are the 1 series to 6 series is the series for surgical procedure, and total marks is 60 questions is allotted for this particular series. It includes all the surgical procedure, right from the integumentary system, surgeries performed on skin, surgery performed on cardiovascular system, surgeries performed on nervous system, all 40 organ systems surgery part comes under this surgical procedure section. The next section is the evolution and management section. It includes 10 questions, and the code series for this evolution and management is 99202 to 99499. This section it involves all the department, all the services provided by the doctor at a different location site. And for example, services provided by doctor under the office visit, services provided by the doctor under emergency department, nursing facility, observation care department. So there are different department in the hospital. So where is exactly the patient and which doctor provide the service, that location based service and the treatment and management of that particular patient service is fall under this ENM service code, which is a evolution and management service code, and the 10 question is allotted for this ENM service code. The next section is the anesthesia section. It involves 8 questions, and the core series for anesthesia is 00100 to 01999, and 99100 to 99140 is the qualifying circumstances code used by the anesthesiologist while performing their services. So this section is also a very easy section, and 8 marks is allotted for the anesthesia service. So all the service performed by the anesthesiologist comes under this anesthesia section. Next section is radiology section. It includes 10 questions, and the code series for radiology section is 70010 to 7999. 7 series is for radiology. Radiology, it involves all the CT scan procedure, MRI procedure, nuclear medicine procedure, MRA procedure, the services provided by the radiologist to a patient. All those services comes under this 7 series, like breast mammogram procedure, PET scan procedure, radiation therapy procedure. All these radiological procedures comes under this section, and the marks allotted for this section is the 10 marks and 10 questions for this section. The next section is pathology and laboratory series. It includes 10 questions, and this section is totally for pathology and laboratory testing. The code series for this is 80047 to 89398. In this section, all the blood test, urine test, culture test, all these DNA test, all the tests which is performed by the pathologist, all these tests come under this pathology and laboratory section. So this section, it includes 10 questions and 10 marks. So next section is a medicine section. This section includes 10 questions, and it involves all the diagnostic testing part comes under the medicine section. So diagnostic testing for ear, diagnostic testing for CVS, diagnostic testing for the eye, and there are the codes for the vaccine administration, sera, toxoid. All this comes under this medicine section, and the marks for this section is 10 marks. So let's move into the another section. The next section is the medical terminology section, and the total mark allotted is 8 questions in this section. It includes all the system, human body, medical terminology codes. It's not a medical terminology code. It includes all the prefix, suffix, and how exactly the medical term is designed. All medical terminology comes under this medical terminology section. For example, hepatomegaly is a medical term. For megaly, it means enlargement. Hepato means liver. So enlargement of liver is a hepatomegaly. So these kind of terms are included in this section. So 8 mark is allotted for this section, and this is very easy section. Next section is the anatomy section. And the total mark for it is a 8 question, 8 mark. Anatomy include all organ system anatomy. So for example, in this section, the anatomy question is asked by the aapc USA in the paper, CPC paper. What type of question they ask? For example, what is the choroid is a part of what? Choroid is a part of eye. So the question related to the organs and the parts of organ system, that kind of question is asked under this anatomy section. So 8 mark is for this section. Next is the questions, 10 question, which is a ICD-10 code based question. So in this section, all the ICD-10 codes are used ICD code based section. So you need to select the proper diagnosis code out of that 4 options. So 10 question allotted to ICD coding. So in this section, all the ICD codes, ICD code for diabetes, ICD code for HIV, ICD code for pressure ulcer. There are the 22 chapters are there based on the organ system and the disease involvement. So the total 10 questions for this section. Next section is the HCPC level 2 codes. In this section, 5 questions are for this particular section. In this section, the services which is provided, for example, durable medical equipment are provided to a patient, supplies are provided to patient, any medication injection are injected to a patient. All these kind of services comes under this HCPC level 2 code set. So total question allotted for this section is a 5 questions. Next section is the coding guideline section. So 6 questions are for this coding guideline. So as I already discussed, there are 22 chapters for this coding guideline. So generally the question asked for under this category is totally based on those ICD-10 CM coding guidelines. So 6 question is allotted for the coding guidelines. And the last section in the CPC exam is the compliance and regulation. So in this section, the question is asked based on the plan type of insurance plans, Medicare plan, Medicaid plan, the guidelines, for example, NCCI edit guideline, local coverage determination, HIPAA policy document, ABN form, relative value units. All the compliance and regulatory kind of questions is asked under this section, and total mark allotted is a 5 questions. So if we check all these 12 modules, the major questions are based on this surgical section, surgical procedure. So this section is very important. So if you practice step by step properly all these sections, their basics, their question type, if you practice this all questions, if you understand the concept of all these questions, you will easily crack the CPC certification. So if you want to join this my training, you can reach out to me on this. This is my mobile number. You can reach out to this number. This is my WhatsApp number, basically 880-603-7250. You can reach out to me on this WhatsApp number, or you can reach out to me on this my email ID ashish.coding@gmail.com. So this is my contact information, and my institute name is AK Business Solution, which is located in Pune. So you can visit personally as well, or you can call me so to schedule your strategy session call with me. So I will explain you more detail about this profession. So thank you for watching this video and have a great day. Bye bye.